Debunk.
Hello and welcome to the Debunk. My name is Bella Twine, and tonight we fact-check a claim that has had very many people in high hopes. This claim has circulated all over social media and also in newspapers. Well, some newspapers might be misleading on how they quoted what the launch was all about. On 28th February 2021, the Red Pepper wrote, and I quote, "Ugandan scientists announced one breakthrough in the war on COVID-19, raising hopes of a drug exclusively developed in Uganda in 6 months." We did a fact check to find out more information to see whether this claim is valid.
This particular article says that Uganda has got a COVID-19 herbal cure. And unfortunately, many people believed this. Is it true or false?
We did a Twitter search to check when this article appeared on the internet. We found out that it appeared on the Red Pepper's verified Twitter account on January 28, 2021 at 10 a.m. We went ahead and checked the State House website, and we found out that President Yoweri Kaguta Museveni launched a clinical trial of a natural COVID-19 treatment drug, not a cure as indicated by Red Pepper.
We also checked with Dr. Monica Musenero, the lead on this research and the presidential advisor on epidemics in Uganda, to find out the facts about this clinical trial.
There was a lot of misunderstanding about the information. We called it, it's a natural, it's a treatment which has come from a natural source, but we have worked a lot on it. It's not that you go to the bush and pick some herbs and take. No, we have done a lot of lab work, a lot of research into it to optimize it, including testing it in animals, analyzing which components are there, removing any components which may be poisonous. So it's kind of a purified form of a natural source. And we have tested it in animals, and now we have reached a point where we are testing it in human beings, because we have certainty that it's likely to work against COVID from the science we have. So that trial is ongoing. So in terms of checking facts, we have a candidate drug. It's not that we have already confirmed it, no. It's now undergoing the testing to confirm it, whether it cures or not. The clinical trial will tell us whether it cures or it doesn't cure.
We dig deep in an interview with Professor Posiano Caleb, the Executive Director, Uganda Virus Research Institute, who gives us an insight in what is meant by a clinical trial and what a drug goes through before being approved by the National Drug Authority.
Sometimes people work in animals, small animals, large animals, to find out whether what you are giving is safe, because safety is the most important thing. Before you come to whether something will help you, is it safe? And if something is safe, they go into the phases. Phase 1, you look at a few people. Again, you look at safety. Is this a drug safe? You look at all the different, the blood, the kidney, and all the different, the heart. What does it do to your skin? You thoroughly look at how safe. Then if it's working, then you go into slightly larger study, more people, and then you design a study. The studies normally that are designed are called randomized placebo-controlled. If you have a disease and you have a group of people, in one group you give your herb, your medicine, and the other group you give what we call a placebo. Say you follow 200 people, 100 will get the drug, 100 don't get the drug. You follow them for a year, and you take whatever you're seeing. If it is to treat some disease, you should get those people who have that disease. You give them the medicine, and the others go to get a placebo. And then at the end, you compare. If a drug works or a herb works, you'll expect that there will be more people who are cured who are given the herb compared to those who didn't get. And this is not just saying these are 90 and the others are 87, so it works. No. We bring in what we call statisticians. Statistics is a way of, again, finding out what would be the difference that will make it significant that, yes, the people you have given the drug are really more than those you have not given the drug in terms of getting or preventing the disease.
A number of media houses misunderstood. At first, when we informed them that we're having the launch, many were saying we are launching a vaccine. Many were saying we have found a final cure. Until you finish the clinical trial, we cannot say it's a cure.
With all these facts, we find out that this particular article is misleading. My name is Regan Chiimba.
The drug is still undergoing the clinical tests and trials. In Uganda, so far, there is nothing like a COVID-19 herbal cure. If you find such fabricated or misleading information, you know who to call. In case you need information about COVID-19, please check the official websites of World Health Organization or the Ministry of Health in Uganda. My name is Bella Twine, and from me and the team, goodbye.